Chapter 4, Part A of the BCSC series in glaucoma. This section will deal with primary open-angle glaucoma, normal tension glaucoma, and then glaucoma suspect patient. Primary open-angle glaucoma is a slowly progressive disease. It's an optic neuropathy, or a group of diseases with a slowly progressive optic neuropathy characterized by atrophy and cupping of the optic nerve head and associated with characteristic patterns of visual field loss. As you can see, IOP is not part of the definition for glaucoma. Now, it's important to note that in primary open-angle glaucoma, the IOP is generally elevated, and this is a distinguishing factor to separate it from normal tension glaucoma patients. However, in general, IOP is not part of the definition or needed to make the diagnosis of glaucoma. For primary open-angle glaucoma, there are 4 strong risk factors. These include age, race, family history, and pressure level. The risk for glaucoma increases with age, especially among African Americans. In individuals over the age of 80, there is about an 11% prevalence of the disease. The prevalence rate roughly doubles every decade of life after 40. Race is another strong risk factor for glaucoma. The prevalence of glaucoma is 4 to 5 times higher in African Americans than in Caucasians. It's also important to remember that blindness is much more common in African Americans than in Caucasians as well, being 4 to 8 times more frequent. Positive family history is the third risk factor. Having a blood relative or sibling with glaucoma increased the risk of glaucoma by about 4-fold in the Baltimore Eye Survey. Finally, elevated IOP is another strong risk factor for primary open-angle glaucoma. Not necessarily all types of glaucoma, but certainly for primary open-angle glaucoma. Here we have a chart taken from the BCSC series showing the prevalence of glaucoma by age and race. Again, you can see that the overall prevalence for glaucoma is much lower in whites than in African Americans. There's roughly a 4-fold increase in prevalence among African Americans as an average. However, there is a general trend in each category for increasing prevalence with increasing age. And again, the general rule of thumb is that the prevalence will roughly double every decade of life over the age of 40. And I typically think of people over 70 having roughly, or can have up to a roughly 10% prevalence for glaucoma. There are, of course, other risk factors for glaucoma as well that just may not be as strong. Some of these risk factors are hypothetical or theoretical. They're thought to basically cause compromise to the blood supply to the optic nerve, or potentially interfere with ganglion cell metabolism or axoplasmic transport. There are also risk factors potentially from extracellular matrix disorders of the lamina cribosa, or inherent problem of the lamina cribosa, which makes it more susceptible to back bowing or mechanical deformation. The interplay of how all of these factors may result in a picture or final glaucomatous pathway is still uncertain. It's probably an interplay of all of these factors together. There are some clinical features of primary open-angle glaucoma that are important. It has an insidious onset. It's slowly progressive, painless, usually bilateral, although it can be very asymmetric. Usually the central visual acuity is spared until late in the disease. And the diagnosis is made from a fairly comprehensive evaluation by a skilled examiner, which takes into account multiple clinical factors, including IOP level, optic nerve head appearance, and visual fields. One important thing to remember about visual field loss in glaucoma is that it occurs slowly, and it's usually asymptomatic until late in the disease. Here we have a picture or a series of pictures which will demonstrate or hopefully illustrate why glaucoma is visionless can be hard to pick out. This is a normal sight, or a photo which could mimic normal sight in an individual.